Mustafa, lead physician in our allergy, immunology, and rheumatology division. And today the focus is on allergies, the differences between allergies and COVID-19. If some of those symptoms might be similar, how can you tell which one maybe you're suffering from? Dr. Mustafa, thanks for taking the time to be here today.
Hey, thanks for having me.
Now, a lot of changes when it comes to treating patients during this time of COVID-19. How have things changed for you and your department over there? And are you seeing patients via telemedicine?
Sure. So absolutely, these are unprecedented times. And when the New York State pause order came in mid-March, we shifted from our normal operations. Initially, we went strictly to telephone visits, but we've transitioned over largely to telemedicine visits. And there have been some loosening regulations where we've been able to use third-party vendors that we're all familiar with, things like FaceTime and Skype and Doximity, which has made some of the telemedicine technology a lot easier to use. We're hoping to transition that over through to the medical record and continue with telemedicine visits. I think they have a space in medicine. We've been talking about it for years, but kind of slacking on it. And then all of a sudden this hit and we've transitioned to it and used it pretty nicely. It works well for some things, but not so well for others. So we're going to kind of continue to use it as part of our practice, but see how things go in the future.
And a lot of talk also now around outpatient services. How are things going to be changing over the next week and beyond for you guys?
Absolutely. So, our first goal was to, as everyone knows, flatten the curve, right? Make sure the cases of COVID-19 didn't surge so much where they overwhelmed the healthcare capacity. I really commend people in Rochester and Monroe County. We've done a great job of that, and we have successfully flattened the curve. But what that means is it doesn't go away. It's going to be here for a while. So, I don't like the phrase the new normal, but the way things are to some degree right now are here to stay. So it's time to appropriately as we can. Social distancing remains the most important thing any of us can do, and I encourage everyone to continue doing that vigilantly. But we need to thoughtfully try to get back to some of the healthcare needs that we have to address, and we do it in a safe fashion where we mitigate risk, but start to do some things that we haven't been doing. A lot of people have heard about elective surgeries, and there's certain types of cancer surgery that are elective and have been put off. So certainly need to start getting those people in a safe way. And similarly, in our office and other offices, there are individuals who do need to be seen in person to get the appropriate medical care. So we're starting to bring them in next week and beyond. We're doing it in a very thoughtful way. We're going to continue social distancing in our office. We're not going to use the waiting room. Our staff are going to have personal protective equipment. Governor Cuomo has asked all citizens in New York State when you're out to wear a mask. So taking these precautions, we are going to slowly start moving forward.
And if someone is suffering from horrible allergies, what is the recommendation right now? I know it's case by case, I'm sure.
Sure. So it's hard because we don't sometimes know if it is just allergies, which you can say, is it necessary to be seen, or is it more than that, right? So I think it's important to differentiate some symptoms. COVID-19 remains a viral infection, so many symptoms that go with viruses, at least maybe a presentation. It can come in a whole host of forms with different manifestations, but nasal congestion, upper airway symptoms are common. And you see that with allergies too. Most cases, not all, but most cases of COVID-19 certainly present with fever. Allergies don't. Sneezing, itchy eyes, things like that, much more common with allergies. So there are ways to differentiate it. If you have concerns, and COVID-19 is on everyone's mind right now, I encourage you to reach out to your healthcare provider. It is an allergy time in Rochester right now. It's spring season, kind of. And so what's pollinating right now is trees. We'll kind of transition from trees into grasses as we get closer to Memorial Day.
There's been some discussion around whether or not some folks are feeling a little cautious about whether or not they should go see a doctor, go to the hospital if something should get to that point. What would your message be to those people who are second guessing it?
Yeah, so my message is social distancing remains the key that we all need to do. But at some point, your visits, your medical care becomes essential, right? And actually staying at home does more damage than maybe visiting your provider. So reach out to your provider, reach out to your doctor and see what the best way to proceed is. For individuals who need to be seen acutely for cardiac issues, strokes, important things, I would say that the hospital is absolutely a safe place for you to go. We don't want you staying at home working through these things on your own. There are certain things that you need to be evaluated for. And frankly, I'm really, really proud of not just Rochester Regional Health, but Strong and the whole community. We have done a really, really, commendable job of taking care of people in a safe way. There has been no shortage of personal protective equipment for our healthcare workers. So we are providing the necessary care, mitigating a risk as much as we can, and helping outcomes. I had a dear friend who had appendicitis during all this. So we don't want you to deal with that at home. Go to the hospital, get it taken care of in a safe way. And I have complete confidence in our hospital systems, our clinicians to do that.
I know you mentioned when you were discussing the differences between allergies and COVID-19, the symptoms, you mentioned trees and pollen for spring allergies right now. Are there any other seasonal allergies that people should be looking out for? And what are the key differences with the spring allergies in particular than with COVID? And also, what are some of the similarities there as well?
Yeah, so I think the allergens that we worry about, there's some year-round allergens. Those are pets, cats and dogs, but other pets, dust mites and mold. Those are here to some degree year-round. The seasonal stuff is tree pollen is springtime right now, grass pollen more summertime, and then fall pollen, ragweed, kind of late summer, fall, when kids hopefully are going back to school. So that's kind of how we see environmental allergies. The similarities between environmental allergies and COVID are really upper airway symptoms, nasal congestion, sore throat. Loss of smell and taste has been associated with COVID-19. It's not typically seen with environmental allergies. It can be. We often see loss of smell and taste with sinus disease, sinus inflammation, chronic sinusitis. That has been associated. The media has reported it with COVID-19, so that's something to be aware of. So those are some of the similarities. Obviously, coughing a little bit with environmental allergies and respiratory symptoms are a big part of COVID. COVID, I think, presents in a whole host of ways, and we're learning more and more about it. Fever is a very, very common symptom. It's more respiratory stuff. The duration, some people, I think people would get URI symptoms and then it kind of gets better, but then worse with COVID. You see the second wave. Allergies are a little more chronic. You've historically had it. People who have allergy symptoms right now kind of know the spring is a tough time for them. Mm-hmm. So there's no one answer. It's a clinical picture. I know COVID-19 is on everyone's minds. And if you have concerns, please reach out to your healthcare provider. There's multiple ways we can address it with telephone visits, telemedicine visits. If you need to be evaluated, we can hopefully do that safely and plan to do that safely.
That was my next question. So if someone is sitting in that boat where they're wondering, are these just my allergies that are really bad today, or is it something worse? Your recommendation to
Absolutely.
call via telemedicine?
Yeah, contact your primary care physician, contact a specialist that you have a relationship with. We're here. We're all working. We're working in different ways and we're working in safe ways, but we're all here working, happy to take care of you. So call us with those questions. And, the key to medicine, we learned in medical school, 95% of medicine is really with the history. So we really want to take a good history, get a sense of, have you had symptoms in previous seasons? Have you had sick contacts? Things like that. And based on that, we can, guide you in the right direction. And if we need to see you in person or have you tested for something, we can absolutely do that. There's a lot of great safe setups in the community.
I know that the next couple of days are looking a little more spring-like than what we've seen. We've been dealing with some cold weather, a lot of rainy weather. How has the recent weather that we've just seen impacted allergy season at this point?
Yeah, allergy season's been fairly typical. Tree pollen is high right now, which is typical for this time of year. We actually had a fairly warm March. I know it's hard to remember back. These last few weeks seem like ages. But we had a fairly warm March with a little bit of a cooler April. It's supposed to be a very nice weekend here. And I encourage people to get outside in a socially distanced way and enjoy the good weather. I think it does wonders for mental health, for the cabin fever that many of us are experiencing right now. Don't start a pickup game of basketball or anything like that, but a hike on a trail, socially distanced from other folks is very appropriate. A really good way to spend a nice weekend here.
And going off of that, with these nice days, I'm sure that a lot of people are planning to get out of the house, go for maybe a bit of a walk, enjoy the outdoors. I know I'm planning to do that myself. So what is your message to the community about the importance of social distancing when so many of us are expected to head out and about this weekend just to enjoy the nice weather?
Yeah, so we have to be cognizant of social distancing. That's really the number one message. This is far from over, and that's going to remain a part of our lives for the foreseeable future. And it needs to, but that doesn't mean you can't get out and enjoy the outdoors. So I would, you know, I started this months ago, 2 months, what are we at? 2 months now, 7 weeks of a lot of common sense and sensibility is going to drive this. We can't make protocols for things we've never experienced before. So should you congregate in a park in close quarters and have a picnic? No, absolutely not. Can you hit a trail and go out for a hike or a bike ride or a walk? I think that's a great idea. You know, Rochester affords us the privilege of social distancing. We have space here. It's different in urban centers, New York City, obviously, where Central Park gets overrun with people. So we have the privilege, be commonsensical, be reasonable about it. It's not just your safety, but it's the safety of so many other people. So we really do have to come together as a community and do what's right now.
Is there anything else that I haven't asked that you want to make sure to get across?
I mean, I think allergies, medical conditions, COVID-19, this is all very difficult right now. And I think it's okay for people to say this is hard, this is unprecedented. But I think as a community, we really have risen to the task, and we will come through it. There's going to be lots of sad stories, unfortunately, and bad outcomes. But as a community, I think we can come out stronger and better for this. And I think just having open lines of communication and keeping the conversation going, there's tons of questions right now. The answers are changing frequently. So please reach out to good sources with your questions, reach out to your docs with questions, and we're here for you, and we'll try to get through this together.
Dr. Mustafa, thank you so much for taking the time to join us today.
Thank you for having me, and have a good weekend.
Thank you. You too. Yes, everyone enjoy the sunshine, but maintain practicing social distancing.